the tool sort of knows what your benefit plan is, what your copays are, what your deductible it is, and it even knows how far you are towards your deductible or if you've already met it.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
We have Liz joining us today. She's worked in the healthcare industry for more than a decade with a focus on the insurance side since 2021. We asked Liz what she likes about working in this industry, and she probably had the best answer I've ever heard. She said, "I like solving problems, and there are a lot of problems." She's not wrong, and I'd have to agree that it's one of the most energizing things, feeling like you have a small part in changing the things you can wherever you can.
Welcome, Liz. Thanks for joining us today. We invited you to join us to talk about price transparency tools. For the average listener who is not closely following the Departments of Labor, Health, and Human Services and the Treasury, in 2023, generally speaking, group health plans and health insurers are required to provide plan members with an online price comparison tool. So the goal is to increase transparency and provide members with some resources to estimate cost for services. And as with everything, there are some caveats, shocker, and fine print, but on the whole, that's the plan. So we invited you to speak to us today and to our listeners about this. So in your words, and maybe it's helpful to kind of go step by step, but let's talk about what it is.
Well, thanks for inviting me. The price comparison tool is required to be available to anybody who has health insurance, and it has to be online, and also it has to be available by phone or on paper upon request, and it's required to show the prices for medical services, but specific to an individual person. So the tool sort of knows what your benefit plan is, what your copays are, what your deductible it is, and it even knows how far you are towards your deductible or if you've already met it. So the prices that it shows will be specific to you, specific to your plan, and specific to where you are in the year.
Ooh.
Of course, like you said, there are some caveats with that. It might not be up to the minute on your deductible and those kinds of data. So there may be a small lag. When you search for a service in the tool, that's the main function. You go into the tool and there's a search engine and you choose a service or some sort of a procedure, a medical procedure, and then the results that it returns will be a list of providers in a certain geographical area who provide that service or that procedure. And it'll show how far away they are from whatever zip code you entered, and it may show their quality ratings. So you can do some compare and contrast, and it'll show how much you'll have to pay for the service or the procedure. The one caveat is that the code you search for, if you type in knee replacement or something like that, might not be the exact same code that your physician actually bills you for when you get that service. So if you're not the doctor actually doing it, you might not use that exact same code. So the price could be different because of that.
Would a search allow you to type in a code specifically, or would you type in it would let you look up a procedure by code? So if you called the doctor's office, because I have done this before, and asked them what the billing code will be, that has allowed me to call the insurance company to say, what is this code? And quite actually, when they changed from ICD-9 to ICD-10 codes for diagnosis codes, I uncovered that you can actually Google those codes, right? And they just sort of tell you what they are. So, walked into pull sequela, it happened more than once. So if you get the coding, so what would the provider use to bill the insurance company? What code are they going to use for this procedure? if the member understands what that code is, that can help them, even if it's the language, because maybe, and maybe you know this, all search tools are required to be able to look them up by code. But if they aren't, if you have that code, it will on an online search probably give you a closer terminology for the actual procedure, what that might be, to your point, if it would vary from knee replacement versus whatever they might technically be calling it, because it could cause something to be billed differently, which is a good point.
Yep, the tool is required to be searchable by plain language descriptions of the procedures and services, as well as the actual codes. Still a caveat though, like if something as complicated as a knee replacement may have other services attached to it, like the anesthesia and all that other stuff. So you may not be able to predict every single thing, but for something simple where you could get the code directly from the doctor, then yeah, no problem. In 2023, plans are required to include 500 shoppable services in the tool, and those services were defined by the government. They sent out a list of what those services are. So those are probably going to be the only 500 that are available in the tool right now. As of January 1st, 2024, all services and procedures are required to be in there.
Obviously, if something is more of an emergency situation and you need something done and it's more specialized, it may not be available. But that's interesting to know that they're going to roll out with everything from A to Z in the future.
And I say January 1st, but technically, if your plan renews in, say, June or October of the year, it won't be available until that date, because that's the date that the plan's required to be compliant. So there could be some early birds, but typically that's the date that your price comparison tool would become available to you.
So in 2023, when your plan year renews, is when the tool should be available for members to start using.
That's correct.
I feel like this is one of those things that everybody will grow up with together, because I feel like networks and providers and the people that have to provide the information that sources a price transparency tool, that's going to get better over time, and there will be more things over time. And once people start to use them, you get more feedback on how well something is working and if it has all the functionality that you need it to have. So I feel like there'll be probably bumps in the road for everybody.
I agree. Yeah, you're exactly right. I think any sort of incomplete data or incorrect data or price estimates that you get that look pretty weird right off the bat, I think over time those will get resolved. Like you said, insurance companies are required to provide the data, but that was sort of an abstract process and they didn't really know what the data was going to look like once you put it into the tool. Now that we can all see that, and once 2023 is over and all those tools are live and we can really get a good sense of what it looks like, I think that those data files will improve and become more usable so that the price estimates are more accurate. And also, as consumers expect for those price estimates to be more and more accurate, and as they are more aware that that's available and that they really want to do those searches and see what the price is going to be before they have to spend their money, then I think that's going to also drive the quality of the tools.
I'm thinking the more people use it, there's going to be a learning curve, obviously, but the more we use it, the more we're going to get from it in the future years. So it's a huge step for the industry, really. It makes sense. It's our bodies and our health and
our money.
Our money.
Yeah. Right? We're going to see how it works. I would not double down on the dollars that are in there, not because they aren't right, but because it's new for everybody. Right?
Absolutely.
That even if you see it, there would be value in calling to verify it before, you put your chips on 21 and roll.
Yeah, I don't think I would make a very large financial decision based on the information in the tool right away.
I hope by the time my daughter's in there searching for like mammogram services, she'll be like, can you believe what the price transparency tools used to look like in 2023? I hope we get to that point.
The Oregon Trail of tools.
Yes.
Sure we are. Pioneers.
Gotta start somewhere. Yeah.
Yep.
And I didn't realize initially when I heard internally about a price transparency tool, my initial understanding was that it was just straight up price, not within the context of your plan. So I feel like that extra layer of it helps you figure out even more so what the end price is to you, between in-network and out-of-network, and all those other factors. It kind of takes that stuff into account for you to help you make smarter decisions.
Yeah.
Even if it's not in 2023, and what it does in this year is help you ask more questions,
Yeah.
it at least provides a layer of visibility that members didn't have before.
Yeah, definitely. And that I do like the fact that it does have in-network and out-of-network. And because that's, I think, one of the hardest things to figure out sometimes is which providers are in-network. Sometimes you can call the provider and they don't know. You can call your health insurance company and they might not even be able to answer that question for sure. So this is a way to even just be able to tell who's in-network and who's not. And if you're searching for something out-of-network, it may not be able to give you an exact price, but it'll do an estimated price based on historical data and how much it's costed in the past. So I think that'll be a really handy thing to have, even if it's not down to the cent exactly. It's still a lot more information than you'd have today in terms of how much is this going to cost.
All right. Well, thank you for
You're
joining
welcome.
us. This is awesome. And I'm sure we'll be tapping you on the shoulder again. Maybe next year we can reassess and see where we're at.
That's a great idea. I love it.
Well, thanks, Liz, for sharing your expertise. We appreciate it.
You're welcome. Thanks for inviting me.
We appreciate you very much. Anytime we can talk to you is a good time.
Always a delight.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.